And next up, we have a presentation of Smart Health Solutions by Health. Gennie, I'll invite on the stage. Health Solutions in the School Education. I'm going to invite the person from Health Gennie, India. We have Mr. Sudhanshu Goyal, Director, Health Gennie, India.
Thank you, ma'am. I know it has been a long day so far, but I will not take a lot of your time. And first of all, I would like to thank Amit ji and Think Unique for inviting me here. There has been a lot of talks on education and skills since yesterday, and there are a lot of enlightening speeches and examples and stories which we all have heard since yesterday. And there are a lot of things involved in it, especially technology, which is one of the most important thing to scale any kind of education or skill among the young Indians across all the institutions across India. Again, good afternoon. My name is Sudhanshu Goyal, and I am the Director of Health Gennie. Today, I'm going to talk about a very different topic, which is smart health solutions. So we have seen since yesterday and heard about a lot of different educational solutions, different ways where students can be skilled and be educated and be prepared for their future. However, obviously that is one of the most important thing to educate everyone. But there is another important thing which we can incorporate as an institution or an organization where we can help students in maintaining or getting the best healthcare or healthcare solutions, which will help them in growing very well, and also creating a kind of an environment where they can help themselves and the parents and the teachers and the entire organization in achieving the goals which they want to. Since everybody has been sitting for long hours, let's do a quick thing where I'll just interact with you guys for a second, and we will just do a small, quick exercise to see how a collective effort is important in creating healthy generations and making this youth of this country skillful and making their future very bright. So we heard yesterday that there is more power when we, close our hands and, maybe hit something rather than opening the hand and hitting it with the same hand. Now, I would like all of you to raise your hand with a fist like this. If you all can please participate, because this is something which will not only give you a good warm-up. I see some of you guys are yawning, some of you guys are tilting on the left or right. So let's do a quick round, and it is a very small exercise, but it will help you in making your blood flow better and also cheer you up. Okay, so now with this fist on the top, let's see if you can clap without opening the fist. Do you want to try that? There is no noise. However, a clap should have a good noise, right? So what is the first thing which everyone should have, especially a student, when they want to, upskill them, or when they are, following their goals or dreams? I think one of the first thing is passion. If they have passion to do something, then obviously all the things will follow. Now, raise your hand again with one thumb out on both the hands and try to clap now. Is passion enough to get what they want to achieve? I think there is no sound, so I think it's not enough. What is another thing? Once they have the passion, they need to work towards it. So hard work is very, very important. So now let's try with two fingers, and try to clap. Still there is no noise. So passion, hard work is not enough. I think there's another thing, which is consistency. So if they follow their passion consistently, then obviously there can be a great result. So let's try with 3 fingers now and see if there is some noise. There is still not much noise, but I can see here and there little noise. So still a student cannot achieve what they want to, or we cannot give them what they want to if they only have these three things. What is the fourth thing? The fourth thing is the diligence, or the availability of the resources for them. Now let's see if with 4 fingers, you try to clap and see if there is any noise. Now you all can hear little noise still. With all the things on the plate, let's see, there is one more thing which is very, very important, not for just students, not for you and me, but for everyone in this world, which is healthcare. Now let's see if adding healthcare can make a difference. I hope you all have a good blood flow now, which is going through the brain and the toe. And you all saw what a combination of a complete platter, including healthcare, can do for students. Moving forward on this, today we're going to talk about smart health solutions. Smart health solution is something which involves technology to provide solution to an individual. I am sure most of you have seen a lot of health smart solutions, and a lot of you are wearing some of the smart solutions, for example, smart watches or mobile devices or any other device which you may have. But why are these smart solutions required? I think one of the most important thing is in today's scenario where the lifestyle is very different from what it used to be 20, 25 years back, is early detection of health issues, which is one of the most important thing. So if there are ways where we can early detect health issues, the most important thing is it helps in early intervention and the solution of the problem. So if you have smart devices or smart solutions, they can help in early detection of health issues. Another thing is promoting healthy lifestyle. Obviously, when you have smart solutions, there are a lot of ways the smart solutions can give you a lot of information where you can promote healthy lifestyles. For example, you might have seen step trackers and weight management and similar other things on mobile apps. Mental health support is another thing where mental health is so important these days, even though it is a taboo. Mental health can be monitored or vigilantly being taken care of with the smart solutions. Efficient health management, where we can maintain our health records, which is not one of the very followed thing in India, and which obviously makes difference in clinical decisions by the doctors if they have a health record from the past. A lot of times doctors ask you for past health records, which is very important to take better clinical decisions. Health education and awareness, specifically for students, smart solutions can give them good education and awareness, which is very, very important, because at this age, when they are student up to 18 years of age, they don't know a lot of things happening in the world in terms of their body, their mind, and what they should do, what they should not do. So I think health education is very important. Safety and emergency responses, there are a lot of detections happening from smart tools in healthcare where emergencies can be taken care of. And once all this thing is done, you can get a lot of data-driven insight which can be used for checking out the common trends which are happening, and then as an institution you can follow certain criteria or follow certain things to solve those common problems in the schools or in organizations for the students. So smart solutions are a good way to go. Now, like I said, there are a lot of different smart healthcare solutions out there, wearable devices such as smartwatches. Telemedicine is something which I'm going to talk about more a little later today. There has been a lot of information on telemedicine from the panel which we had earlier today. So telemedicine is something which has been growing, especially after COVID. Government of India has also created a guideline for telemedicine, which is a very well accepted way or mode in India now for doctors and the patients to use it as part of their healthcare system. Electronic health record, where you can manage your entire health record, which is very useful for the future. Health monitoring apps, you may have used some of them. AI-powered diagnostics. We saw an example where a single drop of blood can give you a lot of test results. Smart medical devices, robotic surgery, remote patient monitoring, and smart hospital management system. These are some of the healthcare solutions which are currently in the market, and a lot of you may have been seeing that also. Now, I'm going to take you through some of the basic healthcare numbers in India, which may make you feel that where we stand today as an Indian and what kind of healthcare is available in India and whether it is reaching to the population which we are targeting, which is the student in this case, or not. The doctor-patient ratio, which is defined by WHO, has been 1 out of 1,000 people, there has to be one doctor. But in India, currently it is one doctor on 1,400 people. So we are still lacking in that part. Life expectancy is very low in India as compared to Western world. It has grown significantly in last few years, but still we are lacking that. Health infrastructure is growing a lot, especially in last 10 years, but around 25,000 primary healthcare CDC and 5,000 community health centers are there in India. Health spending all over GDP is around 3.6%, which is less if we compare it with the Western world, which is around 10%. Mortality rate is high in India. Non-communicable diseases such as heart attacks, diabetes are growing, and we see that all around in everyday life. There are a lot of government initiatives going on currently, especially Ayushman Bharat, which is trying to help every individual to get the right healthcare at the right time and making it affordable. So this is currently where we stand. Now, talking about the students, where our focus is for you and us as an organization, there are a lot of common issues which are faced by these students, especially stress and anxiety because of the way the system has been designed and the pressure they face, depression, sleep disorders, obesity. These are some of the very common things which we see on a daily basis among students. Substance abuse has been increasing a lot in especially remote areas where students are getting addicted to substances. ADHD has been a common issue since early life or early childhood for a lot of students. Asthma and allergies, very common issue among students in the country. Infections, vision, eating disorders, chronic conditions. Even we see diabetic students or children with 10 years of age having diabetes in these days, so which is very, very chronic in nature, and there are a lot of issues with that. And obviously STIs, which students go through when they are in their teenager age and they don't understand the importance of how they should move ahead with their life. I already have gone through most of the common issues. These are some of the mental health issues which we have identified are very common in students. These are almost 128 physical health issues which we have identified in students from age group of 6 years to almost 22 years of age. Now, why do these issues happen? Or you may have seen that these issues has been increasing, or when in your early childhood days, you may not have encountered these issues, but you will see these issues happening with these students these days a lot. One of the common thing is the pressure, the peer pressure, academic pressure of getting good grades, good marks to get into top colleges, universities, or to make a brighter future in the country. This is very, very alarming right now because like we also heard today where we should help students in achieving what they want to or whatever they are good in. So academic pressure is one of the most important thing where even parents pressurize a lot of students or their child to achieve better in what they are not very good in or which they are not interested in. Poor nutrition because of the lifestyle, because of the fast food, because of the way students eat these days. This is one of the major issue where these issues happen. Lack of physical activity. We all know technology and gadgets have been #1 priority for students. They can watch TV or mobile for more than 2 hours at a stretch, but may not do or involve into physical activity, which is very, very important as part of the growth of a child. Inadequate sleep, substance use, mental health, again, is a big stigma. Even if the child has a lot of issues with family, with the teachers, or with anyone else in their system, they may not be able to talk about it. They may not be very comfortable about it because It is a stigma where we see that if a child is talking to a psychologist, the child may have some mental issues, and which is not considered good in our society. But this has been going down, and a lot of people have been now taking care of that and getting involved into a lot of counseling part. Poor hygiene and sanitation, we all know. Lack of health education. Lack of health education is also one of the biggest reason, because teenagers doesn't have the right information and education about their partners or their relationships, which cause a lot of issues with them, and they don't want to talk about it. Chronic health conditions, like I said, diabetes, hypertension, asthma. There are a lot of similar issues which are happening these days because of the environment. Social and environmental factors, like I said, is causing a lot of different issues, especially asthma, allergies, and similar things for children. Now, talking about all these issues, I see that how do we solve this problem? Now, obviously, these issues are growing, and you may see it all around. Being educators and being part of large organizations, schools, and colleges, you may have seen all the issues which I have mentioned today. But how do we solve this problem? Obviously, to solve this problem, there has to be a system or a pattern where every student goes through something where first the preventive care can be taken, where it can be identified whether if they are facing any issues or not. Secondly, every student should have a way to get it very easily. It has to be affordable, accessible, anonymous, which means specifically in mental health, a lot of students don't talk about things. We saw an example today morning when one of the delegates was talking about how a lady in rural area could not talk to the doctor when the doctor is right in front of her, but was able to talk to a doctor on telemedicine platform for 30 minutes and explain all her issues and got the solution to the problem. So anonymity is something which these students or even us look for when we are talking about certain things in life. The environment has to be very safe. The children or the student has to feel safe about it, and it has to have fast delivery because of the today's pace. Everything has to be fast. So we see that if we can solve this problem in these ways, obviously it has to be scalable also, because every child needs to be touched through these kind of solutions. Today, after discussing all these problems and the solution, I would like to introduce you all to Health Gennie. Health Gennie is an affordable, convenient, fast, and holistic digital healthcare platform for students in India, which improves the overall performance and reduces the chances of chronic illness. This is a platform which can be given to students on their mobiles or to the parents on their mobiles, which can help them in getting the care they deserve and they need whenever they need it and wherever they need it. So I think as educators, on top of the education or the skills which you all are providing, there is a small, or I would say a need of intervention of you all to also provide the right health care to these children, because this is something which will help them in growing up in a better way, creating better academic results, and also in helping them in keeping themselves in good shape, which will overall create a good development for them and help them in achieving their goals. As part of Health Gennie, we promote holistic development, which is spiritual, emotional, which is all part of mental health, physical also, where we provide all kind of specialist doctors, social, character development, and academic growth. So we take care of all these important points as part of the overall development of a student. For the institution, it is a great deal to provide such kind of services to students, irrespective of whether you use a platform or not, is building trust among students about the institute. When the student comes to the institute and take admissions, if they see that there are kind of facilities which are available for the students, other than the education, which is obviously for which they are coming to the institute, they will very well accept it and the parents will be very happy about it. Taking care of students should be the utmost priority of the organization. and improve the overall result and efficiency of the student. Because like I said earlier, if you help a student in the overall development of them, other than the education also, then obviously they will produce much better results. And we have seen that after working with more than 8 lakh students so far. Parents can digitally manage and take care of their student from a child of 6-year-old up to 10 years old. A child go to a doctor every month, at least once a month. This is a common data what we see around in India. Because of the environment, because of the food, and because of the way the parents these days are so much worried about their child that they take them to the doctors. So if parents also have a way to manage their child health in a faster way and convenient way, they will really appreciate that. And then it's beneficial for students living away from home because they don't get the kind of care they deserve or they get in their home. So this is very, very important as part of an entire education system to provide such kind of health solutions. Now, a few things about Health Gennie. Health Gennie is India's only holistic digital healthcare platform where we provide complete holistic digital healthcare through telemedicine, physical health consultations through doctors. We have a network of 5,000 doctors across the country with all specialties. We also have a big network of psychologists, clinical psychologists and counseling psychologists across the country. First of its kind, which deals in overall preventive care of an individual. We promote both mental health and physical health awareness, easy consultations with the doctors through mobile app, which is right in your pocket always. Health record management, like I said earlier, very useful for doctors. Medicine reminders, easy access to healthcare services, vital management, health data tracking. As an organization, you can track the health data of all your students through Health Gennie and see a pattern of the common issues which the students may have. There are a lot of issues which students get from their fellow students or from their friends in the school. A lot of times my child goes to the school in a good shape, and when they come back in a day or two, sometimes they feel sick because of getting the infection from a fellow student or a friend. So these environments can be taken care of, these problems, through a system like Health Gennie, where you can track everything and create an environment for students which is better in healthcare. I've already gone through a lot of things, but one of the important aspect is to create a health environment in your organization. You can create health ambassadors within the students, maybe senior students, so that they also get an opportunity for working for school and helping the school in getting the right health care which all the students deserve. You can create a committee of students where they can manage or be held responsible for creating healthy environment in the school. And we at Health Gennie help them in creating those kind of scenarios for you. And also it develops a kind of entrepreneurship skill in the students in colleges and schools both, where a student understands how to manage certain work, how to create new environment, how to help others, how to help the organization and make a better environment. So we provide a health app, which is also known as Health Gennie. It is available on Android and iOS both. You can also download and use it and try and see how it works. Like I said, we are already working with more than 8 lakh students with more than 5,000 plus doctors and counselors across the country. Some of the top educators are working with us very closely. For example, LN, An Academy, Physics Wala, Resonance, a lot of universities are there where we're working across India. We're working with a lot of schools across India. So I think you can always explore this opportunity. We have a booth outside with the name Health Gennie. You can always explore that to see if Health Gennie can be a good option for you as an organization to provide such environment to your students. We are working with a lot of associations, Paytm. We are also signed up with the government of Rajasthan e-Mitra program, where they have 80,000 kiosks across the Rajasthan providing Health Gennie services to students across them. We are registered in Government of India DPIP program and Startup India program also. We are also running a mental health helpline, which is 24/7 for students, where they can call and get any kind of mental health help which they want, anytime they want. With this, I would like to end my presentation and request all of you to also look into a healthcare aspect of the students so that you can give them an overall holistic environment of growth rather than just providing them the education or the skill. With this, we hope that we work together in creating healthy generations and making young Indians grow and take them to the best of what we can. Thank you very much, everyone.